Demonstrating a lower leg exam to check for Osteogenesis Imperfecta. I will first be performing the AP projection. First off, I would ask the patient for 2 patient identifiers to ensure it's them, and then I will ascertain probability of pregnancy if it is a woman, and then I will gather an in-depth history of why we're performing this exam. I would then ask the patient to lay on the table and then roll their pant leg up and remove their sock and shoe. For the AP projection, I'll be using a 14 by 17 inch image receptor at a 40 inch SID. First off, I will shield the patient, protecting their gonadal region, and check my SID, which is 40. Now, since my patient has a longer leg, I had to rotate the cassette diagonally in order to fit the whole part on. If you still cannot fit the whole part on using this method, you should at least get the proximal joint with the 14 by 17 and then use a 10 by 12 to image the rest of the lower leg, including the distal joint. The centering for this projection is mid-lower leg, and to check for rotation, you make sure both epicondyles are equidistant from the image receptor and that the toes are pointing up, and make sure you have both joints on the image. We're going to use a right marker for the right leg, and now I will measure at the central ray. She measures a 9. So I'll now shut the door and set the control panel. Out here at the control panel, we'll be using the extremities non-grid table, and we go to 9. It's 68 kVp at 3 mass with a small focal spot. So I set the receptor to none because we're using tabletop. The filament is small for bony detail, and it's at 3.5 because we can't get to 3, so we got to go up, and 68. And I would just inform the patient to hold still, and then I would take the exposure. Projection of the lower leg. I had my patient rotate onto her right side to better put the lower leg in a true lateral position. I'll now shield the patient, protecting their gonadal region. To check for rotation, you want to make sure that the epicondyles are on top of each other, perpendicular to the image receptor. The central ray is mid-lower leg once again. We're going to be using a right marker. Make sure that you're getting both joints on the image receptor, and collimate to include all soft tissue. I'll now measure the patient. It is a 9 again. And now I will shut the door and set the control panel. Since my patient measured at had the same measurement, nothing changes on the control panel. So I would just make sure that the patient is still holding still, and I will take the exposure.